everyone, welcome back to my channel, Error 404, Mental Health Not Found, your one-stop shop for all things mental health. And today I am bringing you part 2 of my rare and unique disorders and condition episodes. So if you have not seen episode 1, I would recommend that you stop and go back and watch that. That one is all about rare and unique disorders, things like delusions and the like, a lot of really interesting stuff. This one, this episode is going to focus on more physical conditions that are very rare and very uncommon and unique. But before we dive into that, we're going to cover our bases and cover my ass, my very perky cute ass, by letting you know that I am not a doctor. I am not a physician of any kind. I am not a psychiatrist, a therapist. I cannot diagnose you for anything, nor am I trying to. I can also not medicate you for anything. So please, please, please don't start sending me messages asking for medications. It's just not going to happen. I am not qualified to do that. If you are having a mental health crisis of any kind, please stop and seek out professional help immediately. There are people out there whose job it is specifically to deal with people like you and me who have these different medical conditions and mental health issues. So please, please, please seek out medical help. This channel is for entertainment purposes, essentially, and some educational purposes. All of the content that I am providing is coming from either my own personal experience, interviews I have done with professionals, or done a lot of research into figuring out. And I will supply all of my research notes and links to the sources in the show notes for every episode. So if you find that there are any discrepancies, please, please, please let me know. I am more than happy to make edits after the fact. And sometimes I just make mistakes. So please let me know if you see anything that is not correct. With that, I think it's time that we dive into some of these very rare and very unique physical conditions. All right, so first up on our list of rare and unique physical conditions, we are going to be talking about fibrodysplasia ossificans progressiva, or FOP, as I am going to call it. It's an extremely rare and very disabling genetic condition, and is characterized by abnormal growth of bone in muscles, tendons, and ligaments. This abnormal bone growth eventually forms kind of like a second skeleton outside of the body's normal skeleton. FOP is also sometimes referred to as stone man syndrome, due to the progressive ossification. It resembles a stone formation, basically. FOP is caused by mutations in the ACVR1 gene, which, if you need to know more about that, please Google it, which encodes a protein involved in the regulation of bone and muscle development. This mutation then leads to the abnormal activation of bone growth proteins, signaling and resulting in inappropriate bone formations. The hallmark feature of FOP is the progressive formation of heterotrophic bone or extraskeletal bone in soft tissue such as muscles, tendons, and ligaments. This leads to joint stiffness, limited mobility, and eventually the formation of a second skeleton that can severely restrict movement. FOP typically presents in early childhood with malformations of the great toes. So over time, individuals with FOP experience episodic flare-ups characterized by painful, like very painful, soft tissue swellings that eventually undergo ossification. These flare-ups can be triggered by trauma, surgery, or viral infections, but in a lot of cases, They just occur spontaneously, kind of out of nowhere. As the disease progresses, individuals with FOP may experience progressive disability due to the formation of bone with muscles and connective tissues. This can lead to difficulty in performing daily activities, respiratory complications because the chest wall is restricted, and even swallowing difficulties. The diagnosis of FOP is primarily based on clinical features and is confirmed by genetic testing and to detect mutations in that same ACVR1 gene. Imaging studies like X-rays or CT scans can help visualize the abnormal bone formation as well. Currently, there is no cure for FOP. Treatment focuses on managing symptoms, preventing complications. Things like anti-inflammatory medications might be used to manage flare-ups, while physical therapy and assistive devices can help maintain mobility and function. Due to its rarity and complexity, managing FOP requires a multidisciplinary approach involving specialists in things like genetics, orthopedics, rehabilitation, and supportive care. Research into these potential treatments and therapies for FOP is ongoing, but currently management primarily focuses on improving the quality of the life and reducing complications associated with this condition. Stone Man Syndrome. It's got me rock hard. I'm so sorry. All right, so topic number 2, we are going to be talking about congenital insensitivity to pain. Congenital insensitivity to pain, or I'm going to refer to it as CIP, also known as congenital analgesia, and this is not a Miss Congenial contest. It's a rare genetic disorder, and it's characterized by the inability to perceive physical pain, which I don't know what I would do. CIP is typically caused by mutations in genes responsible for transmitting pain signals to the nervous system. One of the most commonly affected genes is the SCN9A gene, which encodes a sodium channel involved in the transmission of pain signals from the peripheral nerves to the brain, so it's not getting what it needs. Individuals with CIP are born without the ability to feel physical pain. This includes all types of pain, including pain caused by tissue damage and neuropathic pain, like caused by damage to the nervous system. As a result, they may not react to harmful stimuli that would typically cause pain in others, such as cuts, burns, and injuries, abrasions, things like that. While individuals with CIP lack the ability to perceive pain, their other sensory functions, such as touch, temperature, and pressure, typically remain unaffected by this. That means that they can still feel sensations like warmth and cold and pressure, and that allows them to detect non-painful stimuli. It's only the painful ones that they are not feeling. The inability to feel pain can lead to a range of complications, as individuals with CIP may fail to recognize injuries or illnesses that would typically cause pain. And without the protective sensation of pain, they may inadvertently injure themselves or develop serious medical conditions that go unnoticed, like fractures, burns, or even infections. And in severe cases, these injuries can lead to chronic health problems or even be very life-threatening if they're not noticing them. The diagnosis of CIP is based on clinical evaluation and may involve genetic testing to identify mutations in the genes associated with pain perception. Additionally, neurological tests like nerve conduction studies or even skin biopsies may be conducted to assess sensory functions. As you're going to find with a lot of these conditions, there's currently no cure for CIP, and treatment focuses on managing symptoms and preventing complications. This might involve educating individuals and their caregivers about the risks associated with the condition and implementing preventative measures to minimize injuries. Overall, CIP is very rare and very challenging condition, and it does require careful management to prevent complications and ensure the well-being of the person affected by this. Okay, so this next one I found to be particularly interesting. The name of it had me at the get-go, and then as I researched into it, it got even more interesting. We're going to talk about alien hand syndrome. Alien hand syndrome, also known as AHS, or anarchic hand, or even Dr. Strangelove syndrome, is a very rare, unique neurological disorder characterized by the involuntary and autonomous movement of one hand that seems to have a will of its own, often in opposition to the individual's intentions. The hallmark symptom of AHS is the sensation that one hand is acting independently, often engaging in purposeful actions without the person's conscious control. This can include activities such as reaching for objects, grasping, touching, or even manipulating items, all of which may be contrary to what the person wants it to do. Alien hand syndrome can manifest in different ways, and it can lead to various types of involuntary movements. These movements can range from simple repetitive actions to much more complex goal-directed behaviors. Some individuals may experience like a flailing or groping movements, while others exhibit more purposeful actions, like an unbuttoning of clothing or manipulating Alien hand syndrome most commonly occurs as a result of damage or dysfunction in the corpus callosum. That is the structure that connects our brain's two hemispheres. This disconnection, it disrupts communication between the brain's hemispheres, leading to conflicting motor commands from the brain and the perception of one hand acting independently. Alien hand syndrome is often associated with neurological conditions that affect the corpus callosum, such as a stroke, traumatic brain injuries, brain tumors, or even neurodegenerative diseases like Alzheimer's or Creutzfeldt-Jakob disease. In some cases, AHS may occur following surgical procedures that involve severing the corpus callosum to treat severe epilepsy. So it can be natural, it can also be caused by a number of different things, but again, it is rare. The diagnosis for alien hand syndrome is based on clinical evaluation and typically involves ruling out other potential causes of involuntary movements like seizures or other movement disorders. Neurological assessments, brain imaging studies such as an MRI or CT scan, and even neuropsychological testing may be used to evaluate the brain structure itself and how it's functioning. There's no specific treatment for alien hand syndrome, but management strategies focus on minimizing the impact of these symptoms and improving the quality of life of the person who is suffering from this. This can involve behavioral interventions such as redirecting the hand's movement or using cognitive strategies to regain control. In some cases, medications or physical therapy may be recommended to address any underlying neurological conditions or to improve motor coordination. It does what it wants. All right, So this next one, you may have come across people who suffer from this one from time to time and noticed things but didn't know what it was or what the cause was. We're going to talk about Goldenhar syndrome. Goldenhar syndrome, also known as oculoauriculovertebral syndrome, or hemifacial microsomia, yes, a rare congenitive disorder, and it's characterized by a wide range of abnormalities affecting the face, the ears, the eyes, and even the spine. Individuals with Goldenhar syndrome often exhibit facial asymmetry, which may include underdevelopment or even absent structures on one side of the face. Microtia, or abnormal development of the external ear, is one of the biggest hallmark features of Goldenhar syndrome. This can range from mild deformities to complete absence of the ear. Additionally, individuals may have inner ear abnormalities, which can lead to hearing loss or even balance problems associated with that. Goldenhar syndrome can affect the eyes in various ways, including eyelid abnormalities. Ocular asymmetry could be up or down, or one might be further to the side than the other, or strabismus, which is a misalignment of the eyes specifically. These abnormalities can impact vision and may require corrective interventions. And then some individuals with Goldenhar syndrome may have abnormalities of the spine, like missing or misshapen vertebrae, curvature of the spine, aka scoliosis, or fusion of the vertebrae. These spinal abnormalities can lead to back pain and may require orthopedic management. Goldenhar syndrome can also affect other organ systems, including a wide range of associated anomalies. These can include things like cardiac defects, renal abnormalities, respiratory problems, limb anomalies, and even central nervous system abnormalities. So it's not just a missing ear or one eye higher than the other. It can lead to a lot of other problems for people. The exact cause of Goldenhar syndrome isn't fully understood, but it's thought to be a result of a combination of both genetic and environmental factors, and in some cases the condition may occur sporadically without any kind of family history behind it, while in others it may be inherited from a autosomal dominant manner or associated with a chromosomal abnormality. The diagnosis for Goldenhar syndrome is based on clinical evaluation, as are a lot of these different conditions, and may involve imaging like X-rays, CT scans, MRIs, all to assess the skeletal and soft tissue abnormalities. The genetic testing may also be performed to identify any associated genetic mutations or chromosomal abnormalities. The treatment for Goldenhar syndrome is typically individualized. It's based on the specific anomalies present. So they're not going to treat you for a spinal injury if you're missing an ear. Management may include surgical interventions to reconstruct facial or ear anomalies, hearing aids or implants for hearing loss, vision correction for ocular abnormalities, or orthopedic interventions for spinal or limb abnormalities, and supportive therapies to address associated medical and developmental issues are going to be crucial in this one. So a lot of it can be treated, but again, no complete cure for this one. All right, so the one before this, we were talking about missing or non-existent or deformed parts of the body. This one is the kind of opposite end of that. We're going to talk about polymelia. And polymelia is also a very rare congenital condition. It's characterized by the presence of one or more extra limbs. Polymelia, which translates literally to many limbs, is a developmental anomaly where an individual is born with additional limbs, and these limbs can be fully formed or rudimentary, and they may appear anywhere along the body, including the arms, the legs, or even on the torso. There's several types of polymelia depending on the number, location of the extra limbs, and I'm gonna butcher some of this. Tetrapus means 4 limbs, pentapus 5 limbs, and hexapus 6 limbs. Those are examples of polymelia types based on the number of extra limbs. The additional limbs may be complete with joints and muscles, or they may be vestigial and non-functional. Vestigial, non-functional. The exact cause of polymelia is not always clear, but it's believed to be a result from disruptions in early embryonic development, and it may occur due to genetic mutations, environmental factors, or exposure to things during pregnancy. Polymelia is considered a very rare occurrence, and specific risk factors aren't very well defined or even well known for it yet. Polymelia can occur as an isolated anomaly or as part of a more complex syndrome with other congenital abnormalities. The presence of additional limbs may be associated with malformations in the musculoskeletal system, cardiovascular system, or even the central nervous system and organ systems. Diagnosis of polymelia should be easy. I mean, do you have an extra limb? But it's typically made based on physical examination and imaging studies like x-rays, ultrasounds, and MRIs. Additional diagnostic tests may be performed to evaluate for associated abnormalities and to assess the function and the structure of these extra limbs. The treatment for polymelia depends on an individual's specific circumstances, including the number, location, and functionality of the extra limbs, as well as associated medical issues. So, surgical removal of non-functional or problematic extra limbs may be considered to help improve a person's cosmetic appearance, also as well as their mobility and overall quality of life. Physical therapy and rehabilitation may also be recommended to optimize function and mobility in individuals who have decided to retain any of these extra limbs. The prognosis for individuals with polymelia varies depending on the severity of the condition and the presence of the associated anomalies. With appropriate medical care and interventions, most people with polymelia, they live happy, healthy, long, productive lives. In fact, they might be more productive. Extra hands. Okay, I'm done. All right, so I've got one more for you that I also found to be incredibly interesting, but before I get into that, I do want to provide a bit of a trigger warning for anyone out there who has had a difficult pregnancy, who may have had any kind of stillbirth or problem during that pregnancy or after that pregnancy. You may want to skip this section entirely. There will be a little bit discussion about that. So just a heads up. We are going to be discussing cyclopia. Cyclopia is a extremely rare and congenital malformation characterized by the fusion of the orbits, so the eye sockets, into a centrally located eye, giving the appearance of a single large eye in the middle of the forehead, which is its defining feature. It's that presence of that single eye in the middle of the forehead, often with a single central pupil, that is most noticeable. This eye may be small or poorly developed and may lack normal structures like eyelids or even proper tear ducts. And in some cases, the nose might be absent or underdeveloped, and the area between the eyes might be flattened or even widened a bit. Cyclopia is often associated with a severe craniofacial or neurological abnormalities, And these may include a single fused nostril located above the eye, the absence of a nose entirely, cleft lip and palate, malformed or absent ears, and incomplete development with the brain. Other organ systems might also be affected, leading to heart defects, respiratory abnormalities, and gastrointestinal malformations. Cyclopia typically occurs as a result of disruptions in early embryonic development, particularly during the formation of the forebrain and the facial structures. It's often associated with mutations in genes that play a critical role in regulating the development of midline structures of the face and brain. Environmental factors such as exposure to teratogenic substances, I think I'm saying that right, during pregnancy may also contribute to the development of cyclopia. The diagnosis of cyclopia is pretty straightforward and typically made based on a physical examination and imaging studies like ultrasounds or MRIs during pregnancy. The condition is usually detected during prenatal screening and ultrasound imaging, although it may be diagnosed at birth based on a physical visual examination. This is the hard part, guys. Cyclopia is usually incompatible with life entirely, and most affected fetuses are stillborn or they die shortly after birth. The severe craniofacial and neurological abnormalities associated with cyclopia often result in profound developmental and functional impairments. And in rare cases where the condition is less severe and associated with other congenital abnormalities like surgical interventions may be considered to address specific medical issues and to help improve the quality of life if they are not stillborn. Management of cyclopia is typically focused on supportive care and addressing associated medical issues. Prenatal counseling and genetic testing may be offered to families with a history of cyclopia and other congenital abnormalities. In cases where the condition is detected during pregnancy, sometimes termination may be considered based on the severity of the abnormalities and the potential impact on the fetus's quality of life, as well as the mother's quality of life. Both need to be considered before making that decision, but in the end, that's up to the mother. That is their choice that they get to make, and nobody gets to tell them otherwise. Cyclopia. Well, that brings us to the end of the second episode of our rare and unique disorders and conditions. I hope you enjoyed both of these episodes as much as I enjoyed filming them and doing all the research involved in them. I learned quite a bit about some disorders and conditions that I otherwise probably just wouldn't know anything about. I feel a little more prepared to understand people as I go out into the world and encounter people. So I hope that this helps bring that wider discussion to the masses. And again, I'm relying on you guys to help spread that word, to help create this safe and environment where these discussions can happen in a way that is loving, protected, and safe. We should never be afraid to discuss our own mental health. We should never be ashamed of conditions that are outside of our control. And we should never shame anyone else for that either. So with that said, I hope you all have a wonderful and spectacular mental health week. And remember, life is just a movie, and our brains, they're the twist we never saw coming. Bye.